we have been using this principle of building our capability to address maternal and child mortality, nutrition, by mobilizing people across the multiple departments and at all levels, as well as the community leadership, to develop tailored solutions enabling people to access care. We have also mobilized the state and local community leadership to increase access and utilization of employment guarantee program and community development. These initiatives have yielded important quick wins, and they are building our state capability to identify and solve problems, adapt solutions, mobilize stakeholders, and collaborate across different groups. So what is the way forward for the Meghalaya state capability, like based on our own experimentations? So we have been developing this state capability enhancement project as we attempt to apply the principles of state capability for development challenges in Meghalaya. And when we just like some of the, when we started working, when we started investing in the decentralized leadership, local leadership, mobilizing these block level officials, village leadership, we can see the kind of a massive, in fact, results in terms of, uptake of the rural employment, in terms of the spending in the rural development sector, you can see there. And next. So again, this led to, a different kind of things, like people coming together and doing like, innovating, mobilizing. We can see that similarly, we've worked on the health sector, the same kind of using the PDIA approach, involving different, departments together. So again, we could see when we worked on the systems, basically systemically, when we started working with a collaborative approach, we could see the kind of results that we have achieved. And this is again a very interesting case, when we have this nutrition is a major issue. When we started again working with a political leadership, draw the attention, there is an authorization that this needs to be actually addressed. There is an administrative leadership. So that all led to, you can see the kind of, the recovery of this severely acute malnourished children, and also the moderately acute malnourished children. In 1 year, you could actually come from almost over 20,000 to now today it's about 1,100. So this is again now current work is that we are working again with the same approach, again collaborating with the different departments, the maternal deaths, because this is again an issue, a systemic issue. We cannot look at as a health problem. This has a gender problem, it's a poverty problem. So it's again working with that systems approach and using again a technology. We also in the process, we also actually started using, a technology kind of that led to again, we could see some initial results, gains of this intervention. Next. So based on this, in fact, these are the, the 6 pillars that we found based on our experimentation within state of Meghalaya. We found these 6 principles are, pillars are very important to build the state capability, or, to see that change that we wanted to see, building that local leadership, essentially, and also making sure that we are promoting that citizen state relationship, through that actually we handled the COVID, involving the communities, how actually we could, address some of the important adaptive challenges, effective use of data, and focusing on that accountability, as well as promoting the agency, and also really empowering the field functionaries to really experiment and find solutions. And we are using a capability through practice approach, not through the training alone. So how actually people do experiment, learn, and iterate, and institutionalize that process. And we also actually working on the systems thinking. In fact, one example is that when we talk about the education, the learning abilities that what we talk about, generally we talk about teachers training, but we are also thinking that maybe we can do even better. Can we think about the early childhood development period before they come to the school? How actually we can address that one? So though there is no, so that this is the kind of things that we are thinking. Next. So now the question is how do we expand and institutionalize the state capability model to tackle other complex development challenges of the state? Here actually we have come out with some kind of course, these are the things that we require a great political leadership, strong political leadership, administrative capability, and again is that we also have to, that will actually result into a greater human and economic development. So taking this, the importance of the political leadership and importance of the administrative, capabilities. How do we, the state leadership can identify and prioritize the areas for Meghalaya and define shared vision and goals. So we'll go to this one. Actually, I would like to show. This is here actually the authorization. As you said, the authorization is important for finding solutions and finding and building the leadership, and then thereafter assembling teams and engage stakeholders and using this problem-driven iterative adaptation process. And through that, we are learning, and these successes and are actually becoming institutionalized.